Breast Cancer Awareness Month wrapping up, we wanted to shine light on an important topic, the risk of reoccurrence after treatment. Here with more is UT Physicians orthopedic surgeon, Dr. Dennis English. Dr. English, welcome to the show.
Thanks for having me, Courtney.
This is a really interesting topic, too, that I think so many of us really need to have this conversation because the message here, I think, number one, that we need to get out is listen to our bodies and really understand that gut feeling. If you think something is out of ordinary, out of sorts, see a doctor.
Absolutely. So thank you for having me. First off, I appreciate it. I'm an orthopedic surgeon and I specialize in bone and muscle tumors. Both tumors that start in the bone and muscle and also tumors that start in other organs and metastasize to them, breast cancer being one of the most common, actually. And so I meet several patients per month that have had a history of breast cancer many years ago and have developed hip pain or knee pain or possibly back pain. And so what we want to do is make patients aware and do some community engagement regarding the possibility that breast tissue and cancer can travel to the bone and affect it in a negative way, destroying bone and potentially leading to pain and possibly fractures as well.
Doctor, how does this happen? I mean, once you have cancer and breast cancer, why is there a simple answer of why it metastasizes, can return back and affect the bone?
So there's not a simple answer to why certain cancers do and why certain cancers don't. As physicians, we have an understanding of certain cancers that do travel to the bone more commonly than others. But why does one woman get breast cancer that travels to the bone, be it immediately after her initial diagnosis or years down the road? We don't have an answer to that. We do have an understanding of some of the mechanics of it and some of the science behind it. So I think we're making some good progress. But one of the realistic issues is that with great chemotherapies and our wonderful oncologists, patients are living for a longer time now. And unfortunately, these medicines don't always protect the bones and the cancer from traveling to the bones.
And I think what's interesting, too, here, and this is a point I think we need to stress, is that breast cancer can affect anyone, even without a family history of that disease.
Absolutely. I couldn't agree more. And so I think that it's important to, do your regular screening, talk with your oncologist, and mostly listen to your bodies. And so, if there's a pain to the back or pain to the hips or pain to the knees and you have a history of cancer, I think it's really important to ask your primary doctor, take a very simple x-ray. It's very low cost, low risk, low radiation, and can be a wonderful screening tool.
Well, we know that we're going to keep you right here, doctor, because we've learned that breast cancer, of course, after the break, we know that breast cancer can return and spread to a patient's bones, and that's exactly what happened to our next guest. We're going to hear her story right after the break.